Thank you so very much for joining us, Dr. Akonde. So
Yeah.
let's
Thanks
we
for
are
having me.
our time is fast spent.
Yeah.
Please, I would like for us to begin this conversation proper for the benefit of those that are listening at home. Please, kindly tell us when you say breast cancer as a medical practitioner, how best can you define? How best can you describe? How best can you tell? What exactly breast cancer means before we even start talking about the types, the symptoms, the causes of breast cancer. What exactly is breast cancer?
Cancer generally means tissues that outgrows other tissues in the body, and cancer can occur in any part of the body.
Mm.
The brain, the skin, lungs, liver. But specifically, we are talking about breast cancer. That's cells within the breast that is outgrowing other cells within the breast, and it can affect both female and male, but predominantly it affects female. Is known that 0.5% to 1% of the population are males, while the rest are females.
Thank you very much for that clarification. Still ahead today on the conversation, talking about breast cancer. You've heard Dr. Akonde Olusoji, who has talked about breast cancer and what exactly it means. And, for the fact that you say that it affects even the male gender,
Yeah.
it is not just a thing for the female gender alone. This is quite strange because the assumption and the belief by so many persons is that when you say breast cancer, we have some people who just believe that it's just for the female. Some men would not even want to hear you talk about it around them because they say it's none of my concern. It's none of my business. It's a thing that affects the women more than the men. Now, let's look at the age now. If you are saying that it affects men, although the women more, what are the age brackets as well? Because sometimes we hear that a young child, a young boy, a young girl has this tumor, has this cancer. What are the age space to looking at those that are affected by breast cancer? Is there any age bracket in particular that we can look out for?
Okay, thank you for that question. The breast cancer in females affect mostly women above age 50.
Okay.
But below age 50, that's premenopausal. That's those who are still menstruating are also significantly affected. In fact, we're beginning to see breast cancer in patients between age 20 and 30 years.
As low as 20?
Yes, as low as 20
Wow.
and 30 years. So that's why it is very necessary for this enlightenment campaign for people not to disregard any presence of abnormality that is noticed within their breast. Also, we talk about lumps. There are lumps in the breast. We could find lumps in the breast of teenagers.
Okay.
But those ones are not malignant. They are not cancerous. But they are lumps. They are also outgrowing other cells, but they are not a type of cancer we're talking about. We call them benign, benign ones. Even that as it may, any lump that is found in a woman's breast should be given the proper attention and proper presentation to those who know how to treat it.
Thank you very much for that one. Today we want to do more of listen to people, ask questions, about this deadly disease, this tumor called breast cancer. But then let us still elaborate further and have a proper understanding. It is believed that when you say breast cancer, there are types of breast cancer. It is not just a one-way thing. It is not just a one thing. So are there really, you are the medical practitioner, you know better, you know the onion of the game, and you are a professional at what you do, and that is why you're a consultant and a surgeon. So tell us, sir, when we say breast cancer, are there really types of breast cancer? And if yes, what are the types of breast cancer that we have?
Well, there are different types of breast cancer.
Okay.
But that is beyond the scope of this discussion. But what is important now is that if a woman finds a lump or an abnormal growth in her breast, should not fail to come to the hospital on time. Early detection and treatment is what we are talking about. Because those who present early, and get early treatment, they get cured at the end of the day. So the other thing I want to say, like I mentioned before, is there is a benign type and there is a malignant type.
Okay.
The malignant type is the one that spreads within short period of time, and that can spread to other parts of the body. It can spread to the lungs, it can spread to the liver, it can spread to the bones. Some can even spread to the spine, and leading to the paralysis of the lower of the legs. You know, so that's why it is important that a woman above 50, even 20 to 30, if you see that there is something that is not okay or that is not normal within your breast, please present to a doctor to examine.
Okay, now let's step this conversation up a little bit. If you see something that is not normal, report to your doctor. What are the things that are not normal? Let us talk about the signs, the symptoms of breast cancer. As a woman, as a man, what are those things you need to look out for? What are those things when you start seeing them or feeling them, then you should see that this is breast cancer, this is the tumor. What are those signs, symptoms of breast cancer?
Okay, before we talk about the signs,
okay,
you talk about, people say, what is the cause of the cancer? But as it is now, the cause is not known.
Exactly.
But there are risk factors.
Okay.
Risk factors are things that you see that, okay, you may say this person may likely have breast cancer. Being a woman is first, because every woman has tendency to have it. And that's why a woman should always examine her breast regularly. Now, age, as a woman grows old, at least about 50 thereabout, they have tendency to have cancer. Or a woman who has a family history of breast cancer. Maybe her mother had breast cancer, died of breast cancer, or her siblings, or first relation, first degree relatives. You know, those kind of patients, you want to have want to tell them to have a regular checkup. And also those who may have had one form of cancer before, like ovarian cancer, has tendency. That possibility that it may develop breast cancer. Also, exposure to certain drugs, like somebody who has had radiotherapy done before, could also have the possibility of developing breast cancer. Those are risk factors. Now, as per symptoms, the main symptom is if you presence of lump inside the breast. If you feel a lump inside your breast, either you discover it yourself or your husband discover it for you. That's one symptoms. Then changes in skin color.
Changes in skin color
of the breast. Then if there is an itching, abnormal itching in the nipple and the tissue surrounding it, that could be an indication that this is something unusual is happening in that breast. Or if you notice that there's a lump, a swelling in the armpit,
okay,
and that could also be an indication that something is happening within the breast that's adjacent to that armpit. And if you see, you look at yourself in the mirror, you see a difference that you notice that there is a difference between the size of the breast. Maybe the right one is getting bigger than the other one, which is not the case before. Then you should raise an alarm that something is happening.
I thank you very much.
And also, if you have a discharge from the nipple, bloody discharge from the nipple, you should try and see a doctor.
Okay, so for those of you listening, you just heard Dr. Akonde talking about some of the risk factor. Being a woman is a major risk factor, just like he has rightly said. So if you are a woman, there are tendencies, not to say 100, but there are tendencies that you should be prepared for such. And at the same time, our doctor talked about age. But I want us to look at that family history. You mentioned family history. So a family where maybe the mother of a particular person actually went through breast cancer, that too must suffer from that. By scale of ranging 1 to 10, the reason for this question is so people can be aware. Some persons have mothers that have actually overcame breast cancer and all. From the scale of 1 to 10, what are the tendencies of such children of that woman having breast cancer?
Yeah, probably we say with like 2%.
Like 2%,
Yeah,
which is still on the safe side.
Which is still on the safe side. But even that as it may, such a woman should not take things for granted. Like what I mean is that if he or she has an opportunity to go for screening, she do so. She shouldn't hesitate to do that. We'll still talk about that one as time goes.
Oh yes, definitely. We will talk about the screening. That is the essence for this conversation, to create a proper awareness to the general public. I'm also concerned about when you talk about exposure to drugs. Now, the exposure to drugs might mean a lot of things to those that have heard you say that. They might feel, okay, maybe because I work with a pharmacy or I work in a pharmacy, I've been exposed to too many drugs, I could have breast cancer. Maybe I work with a manufacturing drug company, I could have breast cancer. Maybe because I take some sort of hard drugs, I could have cancer. So when you say exposure to drugs, for clarification's sake, what do you mean?
Yeah, what I mean by exposure is those who have used some kind of drugs before, like contraceptive pills. Who are exposed to contraceptive pills, who use it for a very long time. It could predispose them to such disease, like oral contraceptive pills, injectables, and generally steroids. That could predispose a woman to. So those women who have a past history of the use of such drugs, they should always take note and make sure that they go for screening for early detection of any lump in their breast.
Okay. So when we talk about screening, how should this be done? There are some screening they will tell you that you need to come every 3 months. Like for instance, the sight. For instance, the ear. Some 6 months, some 3, some yearly. But when it has to do with the breast, and to be sure that I am free from this tumor, this deadly tumor, how does the screening work?
Well, the first thing we always tell our patients, self breast examination.
Okay.
And this doesn't cost you anything. All you need to do, you can do it at least once a week.
Okay.
All you need to do is maybe after taking your bath or before you take your bath, you can stand in front of a mirror and exposing your two breasts with your hands by your side.
Okay.
You look at your breast and compare the size. Normally, paired organs, one is slightly bigger than the other. It will not be that obvious. If you look at our hands, if you measure it critically, one is slightly, but when you notice that the right breast is what's happening is
obviously bigger than the other.
Bigger, you know that something is wrong. Then after doing that, you raise up your hands,
okay,
the two hands up, and then observe the two breasts. If you see any contour, any abnormal contour which was not there, or abnormality which was not there, you should be alarmed that something may be happening. Then after doing that, you bring down your hands back to your side and use the right hand to examine the left breast from one angle to the other. Then we divide the breast into four parts. So the right inner one, the right outer, the lower inner and the lower outer, and also the nipple area. You press gently and examine those sections. Then I use the left hand to examine the right breast.
The right breast.
So while you're doing that, you will feel anything that is abnormal, that is not there before, you should be alarmed and see a doctor. Then when you see a doctor, the doctor is likely to ask you to go and do an ultrasound scan.
Okay.
To further determine what kind of mass or what kind of lump that is inside the breast. Now the other screening that could be done is what we call mammogram. The two breasts. It's what you call screening mammogram. And so somebody that has a risk factor, like somebody that has a family history or that has been exposed to one form of drugs or the other, or that has cancer of the ovary before, you needed to go for mammogram of the two breasts at least once in 2 years will be okay, so that if there's any
once in 2 years.
So even so that if there is any lump that is not normal that is starting at the early stage could be detected. So if those are the two screening exercises that you could do, and also for those that have family history, which is maybe genetically involved, there are other tests that could be done to determine whether the person could have it. Though the tests are expensive, but it could be done in Nigeria. There are three types of tests that could be done to determine if this person is likely develop breast cancer in the future. So those tests are available in Nigeria, though expensive.
So before we even talk about the being expensive or not, because that is one angle at which I was going to ask you. Let's look at the symptoms that you mentioned. And you also talked about the risk factors. Are these also the same for a man? Because a woman standing in front of a mirror, putting her hands by her side, using her left hand to check the right breast and the right hand to check the left breast, is that also applicable to a man? Because in most cases, a man might not have a breast that is as big as that of a woman. So, are the symptoms and risk factors for a woman the same as that of a man?
Yes, the risk factor for man, the risk factor, they are not essentially the same as women. But the man that has had or that also have a family, family history, has a chance of having breast cancer, and also a man that have a form of prostate cancer before could develop breast cancer. Also age as the man goes. So the only thing is that a man's breast is not as big as a woman's breast.
Exactly.
So a woman's breast can hide a lot of things, but a man's breast is not big. Of course, when there is anything abnormal, there is easily. It becomes it's obvious because it's easily seen. The only challenge there is that a lot of men believe that, well, I cannot have breast cancer. What is this one? And they start applying local options. I will advise that any man that also see anything that's not normal in his breast should present himself to a doctor for proper.
I wish we have the luxury of time, but unfortunately, we do not have the time. Before I open the phone lines, maybe I should take this first one before we go ahead. Hello.
Good afternoon. Good morning, sir.
Yes, good morning. Your name, please, and where you're calling from?
Mr. Olajide Stampa.
We're talking about breast cancer today on the issues. Do you have a question for our doctor?
What can cause it for a man? What can cause breast cancer for a man?
For a man?
It happened to me some years ago.
It happened to you some years ago, and you want to know what causes it for a man. Thank you very much. Okay, maybe our doctor will
the cause, like I said before, is unknown. The majority of patients, because there's no known cause for cancer. But what you talk about is the risk factor, which we talk about. And even that risk factor, you discover that about 70% of our patients don't even have risk factor. So some just occur spontaneously. And so nobody can say, okay, this is exactly what is causing. All we're saying is that if there's anything that is not right, please present to.
So we can't tell if it is the kind of food we are eating. We can't tell if it is the environment. What can we really say?
Research is still ongoing to find out what is causing cancer.
In as much as it has taken so many lives and yet not known, the cause for it is not known. Now let's look at those that survive cancer, the survivors. Some believe that when they hear that they have cancer, that this tumor is already there, they just want to take to their fate because it's a deadly disease, yes. But you as a doctor, can you kindly enlighten us? Tell us, is this something that people can survive? Or as soon as you just hear it, just start nurturing it, pamper it till the day that you'll be called to glory?
Well, I can tell you that if you are diagnosed as having cancer, it's not a death sentence.
Good.
If the patient presents early.
Okay.
The patient presents early and treatment is instituted early. A large number of patients survive breast cancer. I have patients that I treated 20 years ago, 15, 20 years ago, and they are still living.
Up until now.
And by the time you are diagnosed as having cancer, you live up to 15, the person is declared cured. So, but the problem with in our society is that a lot of people think after even those that come to the clinic, when you diagnose them for having cancer, when you confirm the diagnosis, and you tell them the line of management, the line of treatment, the first thing they do is they run away.
Exactly.
And they go to church, they go to mosque.
Because they believe it's a spiritual thing.
They go to Abba people, they say it's altar or offer. I don't know how to describe that one.
It's a spiritual attack.
It's a spiritual attack, kind of. And some people say, don't allow them to touch you with needle. Otherwise, it's and by the time they come back, the disease is already advanced. And there is very little any doctor can do at that stage. So it is that time when the patient, you now treat them. If they die, you now say it's a cancer. Like, no, if the patient present early at stage 1, and you treat appropriately, a lot of patients survive it.
Okay, this person likes to say anonymous, but on our social media, WhatsApp, this person is asking why or what is the cause of having breast cancer twice? How possible is that?
If breast cancer affects one breast and it's treated, that's another risk factor. If a patient has a cancer in the right breast and it's treated, there is tendency for her to have it in the second.
So it is possible.
It is possible.
Wow.
In the second breast. In fact, some years back, I've forgotten the name of that American socialite. She went for the test that confirms that she has a genetical tendency to develop breast cancer. There was nothing in her breast. She opted for bilateral removal of the breast. Because she believes that there is that tendency for her to.
And she just wants to stay on the safe side.
She just wants to be on the safe side. And I have seen women in Nigeria too who opted for that too. For them to live, and they are living. And there are other things to sort out that one too. So there is possibility that you could have it
twice. Okay, I think whoever sent this message and wants to stay anonymous, it's fine. But you've heard it is very, very possible. But I want to believe this person, I think, is currently battling with that. Let's leave WhatsApp and come down to a reality check now. Breast cancer is something that as soon as a patient hears that he or she has breast cancer, just like you have also confirmed, they are just doomed to their fate of, let me wait till that day when I will pass. One of the reasons people have that notion or that belief is because it is assumed that to survive breast cancer is expensive. How true is that?
Yeah, in fact, there has been some situation whereby you tell patients the result of your biopsy confirms that you have cancer. They burst into tears. They start crying. Okay, where will I get money to treat myself? What is going to happen to me? Yes, the cost of treatment is a little bit on the high side. And what I want to say is that when you present early, the cost is not as much as when you present late.
Okay.
So early presentation is even cheaper than when you present late. And the outcome too. When you present late, you spend money quite alright, and the outcome is good. When the patient presents late, you spend a lot of money, and the outcome is neither here nor there. So that is where support is very important. There are foundations that give support, and where we needed to appeal to government and well-meaning Nigerians to institute a way of supporting those people that have cancer. Let's talk about cancer generally. Cancer generally, treatment is on the high side, especially now when the cost of things are going high. Some of them, by the time they have their surgery to go for chemotherapy, they say the money is no more funds. They sell their properties, so they still, So cancer treatment needs a lot of support. In Ikorodu General Hospital, the treatment is fairly cheap compared to other centers. So that's why I encourage your patients in this area to try and present to Ikorodu General Hospital.
Yeah, we will come down to Ikorodu General Hospital, especially when you talk about screening, how people can come over and then get themselves checked. Immediately one discovers or is being diagnosed that, okay, you have the tumor. how long can the person live? You know, in terms of some will just need to run around, get money, run around, do this and all of that. Some will tell you, okay, I'll come back. But as a doctor, what would your advice be to someone who has been diagnosed with breast cancer? How speedy does he or she needs to swing into action?
Well, I would say there is no time.
Hmm.
The moment the patient is diagnosed as breast cancer, treatment must start immediately.
Immediately.
If you say you want to wait for 1 week, as you are waiting, the tissue is increasing. I'm sorry, the mass is increasing. You know, as you are waiting. So if you are diagnosed as breast cancer, you don't waste time again. You don't wait. You know, especially in premenopausal women, the tumor is very aggressive. You know, because of their hormonal status. You know, it's usually very aggressive. Within 3 months, it could take over all the whole breast. So there's no time to waste. If you have a lump, you see your doctor, he confirms your diagnosis, treatment starts.
You begin immediately.
Immediately.
So how does this breast cancer, or does it even, if at all, affect one's mental health psychologically, or even in terms of pains or no pains? What I mean is this: when there is breast cancer and the lumps are there or whatever it is, would one start having some kind of unnecessary pain? You know, there are some illnesses, some diseases that you can hardly deal with. You can no longer go out. You can't do anything. Is that same with breast cancer, or the person will just be seeing the unusual growth and then it comes up like that?
Well, at the initial stage, when the lump is noticed, it is not painful. It is not painful. It's a non-painful thing. That's why a lot of people will think, what is this one? It's not paining me.
And they don't really care about it.
You know, but as it advances, it starts, you know, compressing on one nerve or the other, then they start having pain and discomfort. You know, some even it will spread to the armpit. You know,
wow.
And when compressing what we call lymph nodes. You see some of them, the hand start getting swollen. You know, and with a lot of discomfort. But the thing is that at the early stage, it is a painless lump. And that's why a lot of people disregard it. You know, pain is an important factor in the manifestation of the disease. When people have pain, they quickly run to the hospital. But this one, unfortunately, doesn't present with pain.
It doesn't present itself with pain. So how contagious is this? For instance, a woman has it. She shares the same bed with her husband. She shares the same bed with the children, depending on how the case may be. Is this something that is contagious? It can be transferred from the woman to the man, from the woman to the children. Is it contagious at all?
No, it is not. It's not contagious. It's not like tuberculosis. Whereby you cough and people around you, you know, have access to the bacteria. You know, it's not like something that when your skin touches, it's stick on you. No, it's not contagious.
Okay, doctor, before we let you go, our time is of course fast spent already.
I'll talk about treatment.
Yes, I want us to just quickly, let's talk about the treatment in just 3 minutes.
Yes, treatment. Yeah, the most important thing is to present to the right section. A lot of people present to nurses, you know, auxiliary nurses, who doesn't know much about it. Even some doctors, they first of all give antibiotics. If you have a lump and they give you antibiotics, if after that antibiotics there is no change, please, you can humbly ask the doctor, can you refer me to a government hospital for me to go and see the specialists in this area. So when you get there, the doctor will ask you to go and do an ultrasound scan, do the mammogram, depending on what is. Then the most important thing is the biopsy. Take a little out of that lump and send it for special examination to the pathologist who will examine it and write their own report. That's to confirm. So when it's confirmed, the treatment essentially is, some patients, if they present early, they do what you call wide excision, remove it and send them for further treatment. But in most cases, it's the removal of their breast. And when some patients say, but they remove my breast, it's not the end of the world though, because there are things that still could be done, you know, to show that nobody will know whether you have had removal of your breast or not. A lot of people that are going here and there have one tissue or the other that are covered by clots. The most important is for you to survive this disease and go on with your life. Then after that, chemotherapy. There are drugs that kills cancer. And the essence of that drug is that peradventure, some have escaped from that point to the lungs, to the liver, or to the bone. It is the drug that will go there and kill those ones. And that's why we talk about chemotherapy after surgery. And that's another topic for another day, because a lot of people are campaigning against it, which is not right, which is not the right thing. And also radiotherapy too, to kill those cells at the site of surgery. So those are the areas, the modalities of treatment. Also, we have hormonal therapy too. Okay. Depending on the outcome.
So are these stages of treatment optional, or it's a procedure you have to take one by one? Can someone just decide that after the surgery, I'm not going for chemotherapy, or I'll do my chemotherapy and not do my radiotherapy? Should it be a process?
Well, there are some patients that present very early. If you present very early, some of them, you look at her, assess no lump in the armpits. Those ones we can observe them. Okay. That you may not need to go for chemotherapy. But those ones that have the lump and has spread to the axilla, those ones they don't have a choice. You just have to go for chemotherapy. So, okay, let me stop there.
Hello to you. You'll be our last caller for today. I apologize, I've not been taking calls. Hello.
Good afternoon.
Yes, good morning.
Good morning.
Yeah, talk to me real quick, Friday. You have just 1 minute.
Yeah, I want to ask, what about a mother that has breast cancer and gave birth? How is it going to feed the baby?
The baby.
And the second one, what about those people that their breast is bigger than one? Can we say is cancer that causes? I mean, those little children that are growing up.
Okay, thank you, Friday. Just allow the doctor attend to your questions. So the first question he asked, he said a mother who just gave birth, a nursing mother, how is she supposed to breastfeed a child if she has breast cancer? And the second question is that a woman that has one breast is bigger than the other, can that be automatically said to be breast cancer?
Well, a woman that has just delivered, notice that there is a lump in one breast. It can feed a child with the other one.
With the other breast.
The other breast. While she goes for medical assessment. Now, for a lady that notices that there's a difference in the size of the breast, that person should present to the hospital for proper examination. The other thing I want to talk about is the children that are just developing breasts. There are times you may notice a small lump in the two breasts under the nipple. The people should be careful not to mark the patient as having breast cancer. They should present to the hospital.
That's just a form of growth.
It is a form of growth. Because if such is removed, it will stop the development of that breast. That's in a young girl. So we're talking about adults now. If you notice any difference in the size of the breast, please present to the doctor. And also a teenager, if you notice any abdominal lump in your breast, present to the doctor.
Your parting words in just 10 seconds.
So my parting word is to finance. Finance. Finance is very important.
Thank you so very much, Doctor. We hope to have you some other time so we could have a lot of time with you. But we want to appreciate you for your time, for joining us today on the issues. This is how far we can have it on the issues today. Special thanks to our guest, Dr. Akonde Olusoji, a consultant and surgeon from General Hospital Ikorodu. My name is Opeyemi Adebambo. The issues continues tomorrow, same time, same station. And remember to please stay safe, check yourself as a woman most importantly, and you will be fine. God bless Lagos, God bless Nigeria.